Hi, my name is Steven, and this is our wound care video. The first thing I'm going to do is I'm going to check my physician's order, and I'm also going to perform hand hygiene. Next, I will do AIDIT. Knock, knock, knock. Hey, how's it going? My name is Steven. I'm going to be your nurse today. I'm going to be taking care of you. I would ask for 2 identifiers, the patient's name and date of birth, and then I would also let the patient know what's going on. So I'm about here to change your wound. It should take about 10 minutes or so. Can you verify your name? Perfect. Your date of birth? Are you any allergies? And are you in any pain? No? Perfect. So let me get all my supplies together. So next thing I'm going to do is I'm going to assess for pain and medicated 30 minutes prior to the procedure if they need it. Next thing I'll do is I'm going to gather all my supplies, which will be a bottle of sterile saline or saline syringes, tape, wound measuring guide, 4x4 gauze pack, dressing change tray, sterile gloves, non-sterile clean gloves, sterile cotton tip applicator, surgical or abdominal pad. That should be all in my kit, and I'll get all that together right now. Alright, so next I'm going to perform hand hygiene. I'm going to also reassess the patient for pain. And then I'm going to provide comfort and safety for the client. I'm going to raise the bed to a working level so it's comfort for me and for the patient. And I'm also going to get the patient into a comfortable position, either sitting or lying, that provides easy access to the wound. And I'm also going to provide privacy for the patient. Next, I'm going to make sure I have a moisture-proof bag, a biohazard receptacle within reach. And then I'm going to also perform hand hygiene again. And then I'm going to go ahead and put my gloves on. And these are non-sterile clean gloves. Alright, so next thing I'm going to do is I'm going to loosen the edges of the tape of the old dressing, stabilizing the skin. So I will stabilize the skin, loosen the tape, and I'm going to pull opposite the way of the tape as I'm removing the tape. Next I will do on all corners, keeping that skin opposite of the way I'm pulling the tape. Perfect. Excellent. So remove the tape, and then now I'm going to remove the layers, lifting the dressing from the corner toward the center of the wound. So I'm going to remove it, and if I need to, I would moisten it with normal saline before complete removal if the dressing sticks. Alright, so now that I removed the dressing, I'm also going to observe the dressing for drainage. I'm going to notice any amount, color, odor, and consistency before I dispose of it. And I will also dispose of my gloves in the biohazard bag, so I dispose the dressing in the biohazard bag as well. And then next I'm going to assess the wound. I'm going to check, see if I need to obtain a culture, the stage of the wound, the size, the length, the depth, the width, the undermining, and the tunneling or sinus tract. Then I'm going to use the face of a clock to determine the position of the undermine and the sinus tract. I'll check for exudate, pain, I'll check the edges of the wound, the site, the surrounding skin for any infection, and also the wound bed. Alright, after I've assessed the wound, I'm going to perform hand hygiene. And now I'm going to obtain my sterile dressing supplies and sterile gloves and using sterile technique. I'm going to go ahead and open all that. So I've got my sterile gloves and everything. I'm going to open my kit using sterile technique, only touching the corner. Using sterile technique. Alright, and now that I have that, I'm going to go ahead and get all my supplies out. Alright, and then I'm going to get my sterile gloves. Actually, before I do that, once I get my sterile gloves, I'm going to go ahead and put some normal saline in here. And what I can do is I either can use the lipping technique by pouring some out, or just pour directly off since this is a sterile bottle, brand new bottle. No lipping is required. Alright, so I'm going to pour. Okay. Try to stay out of my sterile field. Alright, now that I've poured the saline into the tray, I'm ready to put on my sterile gloves. So to put on my sterile gloves, I'm going to take my non-dominant hand and pinch the outside of the glove, placing the opposite hand into the glove, keeping it away from the body. I'm also going to make sure I do not adjust the glove or change the glove for any reason. I'm going to go ahead and get the other one. So the second one, I'm going to slide my fingers underneath the cuff making sure it only touches the sterile part, and now I can fix my glove any way I need to, and I'm going to adjust the comfort and fit of it. Okay. All right. So next thing I'm going to do is I'm going to use saline moistened sterile gauze to clean the wound, clean it dirty, from top to bottom. So what I'll do is I will have 3 dressings in the saline. All right. So once I have that. All right, so next I'm going to use saline moistened sterile gauze to clean the wound from clean to dirty and from top to bottom. So I'm going to clean the incision line going from top to bottom. I would normally have sterile forceps, but this kit did not come with any, so normally I would be using sterile forceps, so I am just going to act like I'm using sterile forceps to clean. So I would get my gauze, making sure that it's wringed out, not too wet, and then I would clean from top to bottom. Put that into the into the receptacle. Then I would get the next one. I'm going to clean along the sides from top to bottom. So I'll do this side. And then I would get my last one. And then I would clean the opposite side. And then next I'm going to discard of any pieces of gauze in the biohazard after each time that I clean, never using the same one over again. And then now I'm ready to do a wet to damp. Normally I would have to reset a whole field up, but this kit actually came with everything I need to actually go ahead and pack it. Maintain sterility, making sure when I open everything that I kept sterility, keep it in my field of view, making sure it's not below my waist. I'm also making sure that I'm not breaking the sterile field by reaching over the sterile field, making sure that I'm not turning my back to the sterile field to make sure I maintain that sterility. I opened the sterile gauze, already put it into the saline so that it can go ahead and moisten it. And then I performed hand hygiene and put on sterile gloves, but all that is already done since this kit came with everything. So next I'm going to go ahead and apply the moist dressing onto the wound. And I would normally, on this one, I would wring out all excess moisture from gauze before applying it to the wound. And then normally I would have a sterile forceps or cotton applicator to be able to actually put this into the wound. So it's going to go into the wound, and if I had the sterile forceps or cotton applicator, I'm going to put it into any depression or crevice of the wound. I'm going to show the deep depressions or sinus tracts are filled with gauze. And then I would, if I need to, I would apply a secondary layer, moist layer, onto the first layer, repeating this process until the wound is completely filled with moistened gauze. Next, I'm going to make sure not to pack the gauze tightly into the surrounding tissue, and I will cover the wound. Cover the wound with another gauze to go ahead and cover it. And then I'm going to cover the moist gauze with a surgical pad or abdominal pad, which got that here. Go ahead and making sure that's fully covered. And then I'm going to secure the dressing with tape. So next I'm going to go ahead and make sure. Making sure I'm covering it completely. Making sure all the corners and everything are down. All right, once I've done that, I'm going to dispose of my gloves in the sterile field in a biohazardous bin. First thing I do is I make sure if I had scissors in this is going to go into the sharps container. So that'll go in the sharps container. And I would go ahead and wrap all my stuff up to go into the biohazard receptacle. Okay, that right here, and that went into the receptacle, and then the normal saline that can be used again. And I would go ahead and pull it off into the hand, ball it up into this hand, and go ahead and place that and put that into the receptacle as well. Perform hand hygiene, and then I will also place a date, time, and initial onto the dressing, and then that is all.